So for the first topic of dog codes, let's talk about this whole erectile dysfunction situation in younger men. Like, what's up with that? Just see the commercials for like Rose bars, or we see hymns, and everybody's just cool with that. But like young men to be seeking out erectile dysfunction medication, or Kodak at 20-something years old talking about he popping Cialis, or everybody taking honey packs, bro, we too young for that, ain't we? So let's dive into that. While I think that's just a hunch that I be having, that's usually start me. So then I go and look it up, and it's like, in a 2017 study, they found that 1 in 4 men seeking treatment was under 40. Bro, Viagra used to just be for old people. Like, what's good? Like, what's really happening right now? So let's talk about what the definition is of erectile dysfunction. And I'm gonna read it so I can quote it verbatim. Persistent or reoccurring inability to attain or maintain a penile erection sufficient for satisfactory sexual performance for at least 3 months. So, bro, if you have a bad day, bro, you just had a bad day. You ain't gotta, bro, you ain't really gotta, just chill, bro. Like, the case is mild, is really just occasional difficulty, moderate is frequent difficulty, and then severe is obviously complete inability to even get your mans right. So there's levels to it. Let's also talk about like how erection normally happens. So first, you have a sexual stimulation that stimulates your body to release nitric oxide from your endothelium, which activates guanylate cyclase, which converts GTP to cGMP. And I know I'm saying a lot of things, but once we start talking about medications, it'll hopefully align a little bit for you. And it leads to your muscles basically relaxing, vasodilation. You have the inflow of blood, which creates the erection. What stops the erection is something called PDE5. I'll put the word right here. That cleaves the cGMP that was made earlier, which basically cuts off the energy that's in the muscles, stops the erection. Remember, PDE5. So in my research, I also found some things that could be contributing to this in younger populations. So I think overall, a health issue is that if we have a lot of cardiovascular or atherosclerotic plaque in our bodies, which is usually a product of poor cardiovascular health, it can get into these smaller blood vessels, which is in the penis. So that would make it a little hard for blood to get in there. But also, I think there was something that I found that was very interesting to me was, it's also from a psychological standpoint. So what they've seen is that sometimes your brain can't even stimulate sexual stimulation. And they said that that came from too much porn. There's so much porn available to you all the time, whether it's Instagram, Twitter, notorious. It's OnlyFans, not to shame any of them, just saying like it's so accessible that actually can be a factor in erectile dysfunction. And I think that would make sense in the correlation to younger men, because it was a study where it's seen that men in 18 to 40 years old who had ED, 91% of them didn't have diabetes, 79% of them didn't have hypertension. So it was a psychogenic factor that led to their erectile dysfunction. And I think that's very interesting. Correlation. Now, I don't want y'all to think that every man out here just got a porn addiction that is dealing with this erectile dysfunction. There's other psychological factors into it as well. There was a study done in 2023 where it showed that anxiety and depression also led to erectile dysfunction as well. So anxiety led to an increase in sympathetic tone, which in our body increases our norepinephrine, which increases vasoconstriction, so tighten up our blood vessels, which makes it difficult for blood to get there and cause an erection. So then you'll have a failed erection, which leads to erectile dysfunction. So that was also pretty prevalent as well, actually more prevalent than the pornography. So let's talk about the drugs. So some of the drugs that people use when diagnosed with ED is sildenafil, tadalafil, vardenafil, as well as amanafil. These are PDE5 inhibitors. If you remember when I was talking earlier PDE5 is what cleaves the CGMP, which ends the erection. So essentially this allows a maximum amount of blood flow to the penis. Essentially, it gives you a higher rate of having successful erection. I'm gonna put like data stats about each one. It's too much. Also, biggest thing with the PDE5 inhibitors, you have to avoid nitrates. That is a big no-no. If you also remember, nitric oxide is what causes the vasodilation. So if you have endless supply of nitric oxide coming to the blood flow, and then we are also cleaving the PDE5, which stops the erection, it's like you're just gonna keep on vasodilating, which can cause severe hypotension, where basically severe low blood pressure, which could be deadly. So also, there are a bunch of medications that can also contribute to ED as well. I'm just gonna list those. It's a bunch of them from different side effects. It could be from decreasing blood flow. It could be from decreasing the amount of testosterone produced, which also is vital in producing an erection. And I'm just gonna list those as well. There are also natural products that help increase nitric oxide levels. There are also some supplements that also help as well. And I think the bigger thing to me is that sometimes we need to know about the natural products that we can take too. And just some day-to-day things. They recommend losing 5 to 10% of your body weight. So losing some weight, daily exercises, Kegel exercises, even for men. And I'm gonna list a bunch of other things that you can do as well, because not everything needs a medication, unfortunately. I think, you know, me being a pharmacist, people would think that I would believe the opposite, me being a pharmacist, but I would say that not every time that you need a medication. A lot of these times in studies, the people that they are doing the studies on are unhealthy people. So therefore, for unhealthy people, medications probably work better than natural products. However, if you're not necessarily an unhealthy person and you have healthy routines and this is something you're experiencing with, it could be one of the medications you may be taking, or it could be a psychological factor. So also psychotherapy is also recommended as well. But I think that when you're living a healthier lifestyle, then natural products to me should be your first choice. So no disrespect to roast sparks, no disrespect to hams, no disrespect to the people that do the wipes, no disrespect to the people that do the honey packets. But I think that if we come together as a community and really see that these are problems in our community, I think we can help out a lot of young men, a lot of relationships in general that are experiencing this. If anything that I gave you today was helpful, let me know.